Yeah. So how did you turn your life around? Because obviously you're vibrant, you're lecturing everywhere, and then you have your own center, beautiful place in El Segundo. How did you turn your life around? What did you do?
Originally, yes. So when I was just feeling horrible, again, no exposure to anything integrative, alternative, precision, functional, whatever. And I kind of snuck off, and I'm like, because I'm told it's not evidence-based, so I'm listening to these lectures, and I'm like, this is more evidence-based than what they're teaching me. I mean, this is crazy. And so I really kind of latched on to thyroid and really got into it. I think it was Rousier at that time. And then so I quit anesthesia and just took over, went to family practice, took over a family practice and opened up the Thyroid Optimization Center. And it was an insurance practice and converted to cash with less than a year because we didn't market. People waiting in line outside the doors because we're just getting so many people better with T3 and, not going by the TSH. And I'm telling you, if any, physicians out there or patients that are sick, like almost always the thyroid is low and treating away with T3 is just miraculous. You combine, if you learn thyroid and peptides, you will have, throw a little stem cells in there, maybe a little ozone. You will have patients from everywhere. You'll be getting patients better. I've seen the most amazing doctors and, 15 doctors because they're missing those things. And, and we started the nonprofit National Academy of Hypothyroidism just to really show that the way we're practicing, diagnosing and treating thyroid in this country is wrong. It's not evidence-based. And so like 80% of people go undiagnosed and all they need is a little T3 and it's amazing. I can go on and on with studies on that. So a lot of lectures on that. So I won't, I can tend to just go off on that, but I want to cover some other stuff today.
Well, some people say that thyroid is possibly overtreated. For anti-aging arena, like everybody has, very few people have perfect T3s. Right? So if you try to optimize T3 and then that suppresses TSH to a great degree, is that too much?
Yeah, no, TSH is the most worthless diagnostic parameter. And you can overdose. The people that get too much are on T4 and it's making all this reverse T3. And for instance, we can talk about the thyroid bioregulator, which is very interesting, or thyroid axis bioregulator. And because what happens when people are chronically ill with inflammation, stress, age, inflammation, autoimmunity, whatever it may be, they get pineal hypothalamic pituitary thyroid dysfunction. So they have a central hypothyroidism, right? And so we always think that, well, it's really easy that when the thyroid levels drop, the pituitary responds, increases TSH. No, it does not. It's damaged too, even more than the thyroid. So they have, this is the pattern of a low thyroid, chronically ill, chronically inflamed person. Is a low normal TSH, a high normal T4, and I'll tell you why, and then a low normal free T3 and a high normal reverse T3. But if most doctors will look at that, they go, oh, you got low normal TSH and a high normal T4. Oh, you're a little hyperthyroid. It's the opposite. And because the thyroid doesn't get, especially T4, does not get into the cell because of its active transport. All the endocrinologists think it just diffuses in. T3 is less energy dependent than T4. And also the deiodinases would convert T4 to T3 in the body with any inflammation, age, stress. It goes down. The deiodinase type 1 is downregulated, so you get less T4, T3. In the pituitary, it goes up. It's stimulated, so you get more conversion. So TSH goes down as the rest of the body's starving for thyroid. And actually, look at depressed patients. For instance, the largest study ever done on antidepressants, the STAR report, showed that giving T3 was a better antidepressant than every other antidepressant, less side effects. It worked when the other ones didn't. Another study like bipolar patients, 135 treatment-resistant bipolar patients. They tried on average 14 different medications, no response. They gave them all T3 regardless of their thyroid levels. 80% responded and 30% total resolution of symptoms.
Okay. So you will feel pretty comfortable just looking at people's free T3 level then, as far as target?
No, what we'll do is we'll check everyone's basal metabolic rate, which is the gold standard. Also, the British Medical Journal showed that a knowledgeable doctor looking at someone's ankle reflex was a better test than blood tests. They correlated with symptoms better. They diagnosed people that actually benefited from the treatment. So how could that be? So a normal reflex goes, but the lower the tissue level of thyroid, the slower the oxidation phase. So we have a computer that measures that. Combine that with the basal metabolic rate, you have your diagnosis. And if people diet more than 3 sessions, they'll drop their metabolism, their thyroid levels drop, and it doesn't go back to normal even when you go back to normal eating. So people say, I've wrecked my metabolism. They have, but their thyroid function tests look normal. So many people need T3, and it's shown to reduce cardiovascular disease and risk factors. And it's one of those other conspiracies that it's just nuts that people aren't doing it.
What's the level that you would target your patients at for a free T3?
Well, I mean, that's just kind of like one parameter. So you got it. Like we do all the tests, and symptoms matter a lot too. Check their body temperature, and so there's no set number. And you can look at also the free T3, reverse T ratio, the T4, T3. People, love all the mathematics stuff. And we have actually a test, if you go on National Academy of Hypothyroidism, an algorithm that goes through it. But, there is, I would say you need it, but it's also common sense and the art of medicine where we've had some doctors that they're just like, well, you said that the TSH, it doesn't matter. Like, just keep giving more. No. What are you talking about? The person, they're racing hard. They just keep giving them more. Like, stop it. So it's like being a doctor. It's like, well, how do I know what to do? You're a doctor. Okay. So, or even you get like family practice docs, like the TSH is like 8 and like, I don't know what to do. Like, oh my God, but I don't know, it's scary. I don't mean to, but, we're just like kicking out of our own way,
Yeah.